Okay, this is great. This is my favorite thing. It's so wild. Okay. You ever heard of Diet Coke? Okay. Now, do you think Diet Coke helps you lose weight?
No.
Why not drink regular Coke?
Taste.
Okay. So the only reason for putting Splenda in your iced tea is for sport. In other words, you're not going to do it because you think it loses any calories.
Correct.
Right. Well, that's okay. Many people think that putting an artificial sweetener in their iced tea helps protect them from obesity because they're eating a low-calorie drink. Or they can drink a Diet Coke. Like, for example, we hear this a lot. You go to McDonald's, you order a quarter pounder with cheese, extra large fries, and a Diet Coke because I'm watching my weight. Okay. The research is very clear that artificial sweeteners cause increased weight gain. So if you drink Diet Coke, you're welcome to. It's going to make you heavier than if you drank regular Coke. So they took two groups of mice. One group was the Diet Coke mice, and the other group was the Coca-Cola regular mice. At the end of 6 months, which group was heavier? The Diet Coke group. Then they took another group of mice, a study from Purdue, and they just added some saccharin to the water for the mice, and that group was much heavier.
Do you feel the same way about these new power drinks that are, lower in calories, the same type of situation?
It doesn't. There are two reasons to drink Gatorade. One is to resuscitate you from hypovolemia. The other is just for grins because you want something to drink. I wouldn't drink it for grins. It's good if you need salt to resuscitate you if you're hypotensive, you're dehydrated. Otherwise, the sugar in it's unnecessary and I wouldn't drink it. Now, can you do well by eating Propel or drinking Propel or something like that, which has an artificial sweetener in it? That's going to make you heavier. Better to have orange juice or something healthy. Imagine you were the president of the Coca-Cola company. Imagine you're in that role now. You're president of Coca-Cola. If you knew of any research at all that showed that Diet Coke helped protect you from weight gain or induced weight loss, wouldn't you put that in every single advertisement for Diet Coke that you had? Wouldn't it be on the top of every end cap in every grocery store in America? Have you seen anything about how Diet Coke causes weight loss? No. You know why? It don't. Large-scale studies of hundreds of thousands of people, asking them in a survey, how many cans of diet drink do you drink per day? The more cans of diet drink, the heavier the patient. Don't use artificial sweeteners. So, for example, post-op, should you get the unsweetened, sugar-free, non-fat yogurt? Should you get the Snackwell's cookies? Non-fat, sugar-free Snackwell's cookies.
Are you putting Splenda in the same category as the saccharin?
You bet.
So for a sweetener, you would in your tea.
Use sugar.
Sure.
How about something like honey?
Honey's fine. Honey is sugar. It's just called fructose. So, yeah. Now, is it a good idea to have tons of sugar in your tea? No. But people want, that's okay. Well, I'll be good. I still want the sweetness. I'm going to have artificial sweetener. No. Bad idea.
I used to eat okay, but I don't want to sweet anymore.
Well, many of our patients still have a sweet tooth, but we say you can't eat a sweet thing and say you can do it without fear it's going to hurt you. If you eat something that's artificially sweetened, what the studies show is your body will go out and get the equal calories and more from what that artificial sweetener replaced. So artificial sweeteners absolutely should never be eaten in anything that you have.
Anytime.
Ever, if you ask my advice. The research is clear.
Dr. Rutledge, what about stevia? That's natural.
I don't know. I assume that it would work the same as the other artificial sweeteners. If you want something sweet, eat sugar and eat very little of it.
Stevia is a root, isn't it? It's not an artificial.
Well, the thing is, does it trick your sweet tooth into thinking that you've had sugar? and my understanding is that it does. It's not sugar. You can't get away with, there's no low-calorie way to get around sugar. If you trick your brain and say, ah, ha, 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 this tastes sweet, but there's no calories here, your brain says, ha, 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 I'll get you later.
So the short list of things to drink after the surgery would be,
All kinds of fresh, healthy foods. So orange juice, grapefruit juice, tomato juice, green tea.
water.
Why?
Water.
Water's okay.
Doctor, how long do we drink the Gatorade? Should I like be done with that now?
Yeah, you should be done with it.
How long do you suggest someone from state of surgery to take Gatorade?
6 months after surgery, one of my patients called me and she said, Dr. Rutledge, you're wonderful, you've changed my life, this is great, but I have a problem. I said, okay, what's that? She says, they will not let me go to jazzercise. I said, why is that? She said, well, I keep passing out. So I said, are you drinking? She said, sure. I said, what do you drink? She said, 2 bottles of water. Change it to Gatorade. She stopped passing out. 3 years post-op, a patient called me and said, Dr. Rutledge, just calling to let you know for your medical records that I had a stroke. And I said, don't. She said, don't. I just, no. Wait a minute, Dr. Rutledge, I just called to let you know I had a stroke. I said, no, my patients don't get strokes. In other words, I have lots of my patients that preoperatively had strokes and heart attacks, post-operatively, after the first month, none. She said, well, my doctor said I had a stroke. I said, tell me about it. She said, well, my mom's been in the hospital, she's been sick, and I've been caring for her. And I said, on the morning that you had your stroke, what were you eating for breakfast? She said, nothing, I was late, I had to get to the hospital. I said, okay, what'd you eat for lunch? She said, I didn't, I was busy. And I said, you had your stroke about 3 o'clock in the afternoon. She goes, yeah. And I said, you're in the hospital? Yeah. They took you down to the ER? Yeah. They did a scan of your brain? Yeah. They didn't find anything. She goes, yeah, they said it was a mild stroke. And I said, do you remember the manual? She goes, the manual? I said, do you remember salt? She goes, salt. Gatorade? Gatorade. So you can't go all day. You'll pass out. So that woman could have avoided that with some Gatorade or regular food. Gatorade is nothing special. It's salt and water and sugar. So you don't need Gatorade, but if you're stuck, you're driving, you're taking care of mama, you're at jazzercise, Gatorade's a good resource to resuscitate you.
I've got a question. After the surgery, how long are you supposed to stay home before you go back to work?
At least a day. We have another question that often comes up, and it's kind of a delicate one, so I want to be careful how I bring it up. But a question about intimate relations. And we have a hard and fast rule that you're to refrain from intimate relations until you're out of the hospital. Makes rounds very embarrassing. Any other comments?
No?
You look beautiful. Congratulations. Okay. Any other post-op